This is, despite the fact that it says presenters on the handout, we're really going to keep this pretty much a facilitated discussion. We invited some speakers here who have a wealth of experience in this area, and we're sort of competing a little bit with the evidence-based approaches for them. So I appreciate you people coming here after a couple days of high-energy discussions. We'll keep this, like I said, very informal. What we're going to be talking about today is data-driven strategies and sort of a high bar, comprehensive knowledge and data management strategies for your comprehensive youth plans. The comment was made from the gentleman from San Jose that we need to keep it simple. So we're sort of covering that whole breadth of keeping it simple but getting to comprehensive. And I think if we do that in sort of a stepwise way, sort of a crawl, walk, and run, I think we can make that more achievable. I've looked at all the plans from the individual sites, and I can see that to different degrees, the agencies have already integrated data into forming their plans and have plans for doing more rigorous data sharing. We had some great questions in the session before last about data sharing, so hopefully we'll be able to delve in deeper to that. So I just want to frame the issues a little bit after we do introductions. We're going to be hearing from Anthony Braga as a lead discussant to talk about some of his work with Project Safe Neighborhoods, pulling levers, focused deterrence approaches, what lessons have been learned. As we look at the plans, we see that a lot of people are building off their existing programs in those areas. So hopefully we'll have a lot of feedback and a lot of comments regarding his remarks. And then we're going to talk with Andrew Wong, who's developed various software for pulling together information, for linking information from disparate data sets, and using it for both case management and risk assessment in a very careful and deliberate way, in a way that resonates with me. I'm a research person by background, and I've always been very attentive to data quality and the business rules by which data is generated, and really sort of having a firm understanding of that, sort of knowing the capacities and limitations of your data. I worked with Becky Block many years ago, for those of you who know her, and her mantra is always know your data. Kind of a geeky thing to do, but something I believe in. And then we want to talk about perspectives from the site, what your challenges and successes are. And Barbara from Boston, I think we heard about your challenges a little bit. So hopefully we'll have time to delve into that a little bit more. And then open it up in general to questions. Again, facilitate discussion. So if there are comments throughout this, please feel free to raise your hand and interject. So with that, let's start with introductions. I'll start with myself briefly. My name is John Markovic. I'm a program manager, social science analyst with the COPS office. Before that, I was with the International Association of Chiefs of Police, and before that with the Vera Institute in New York, and also did some research work in Chicago with a project on human development in Chicago neighborhoods.
I'm Megan Levine. I'm an intern with the Office of Juvenile Justice Delinquency Prevention.
I'm Ellen Scrivener. I'm Deputy Director of the National Institute of Justice.
I'm Elliot Robinson. I'm the Director of Monterey County's Department of Social and Employment Services.
Good morning. My name is Louis Featheroff. I'm the Chief of Police in the City of Salinas.
Melissa Neese, Program Specialist for Partnership and Technical Assistance Division at the COPS office.
Rich Janikowski, I'm from the University of Memphis. I've been the research partner both for this strategic plan and Operation Safe Community, which is the 5-year plan that we're talking about.
And let me interject here. Professor Janikowski was very helpful with me in sort of developing this session, talking about data sharing, how they've integrated into their Memphis plan, and also what some other things are going on nationally. Anthony?
Anthony Braga. I'm a professor at Rutgers University and a senior fellow at Harvard, and I work very closely with a number of police departments throughout the country and their criminal justice, community-based and social service partners to develop comprehensive violence prevention strategies.
My name is Andy Wong. I'm president of AJW Inc.
I'm Barbara Ferrer, the Health Commissioner for Boston.
Ulrich Baker, City of Detroit Youth Violence Prevention Coordinator.
Yvonne Anthony, Director and Public Health Officer for the City of Detroit. Beverly Tran, Office of Commonwealth Matters.
Katarina Roman in the Department of Criminal Justice at Temple University. I'm part of the small assessment team that's looking at the national forum. You'll hear about us this afternoon.
Jose Salcio, Senior Policy Advisor for Mayor Chuck Reed, City of San Jose, on public safety.
Andrea Flores Shelton, I'm on the San Jose team, and I work for Santa Clara County Supervisor George Shirokama.
Ellen Williams, I'm a Special Assistant to the Director of the Bureau of Justice Assistance.
Jeanette Cutler, also EJA Advisor.
I'm Eric Keller. I'm at the Department of Health and Human Services, and I'm working on an interagency working group for youth programs, as well as the findyouth.gov website.
Gerald Darling, Chief of Safety, Security, Emergency Management, Memphis City Schools.
Scott Wayne, Joyce Foundation, help run the gun violence program.
Saber Horn, Director of Communications at Office of Justice Programs.
Frank Stroud, Public Safety Director, City of Indianapolis.
Jeff Slowakowski, also Juvenile Justice and Delinquency Prevention. And Nora Stickard, U.S. Department of Education.
Good morning, Robin Delaney Shabazz, also OJJDP with the Coordinating Council on Juvenile Justice and Delinquency Prevention.
Did we miss anybody? Okay, thanks. All right. Many of you who have been immersed in your plans, I think will know this. Something that we've talked about in our monthly meetings, as well as among the federal stakeholders. We sort of envision that there are three ideal elements of what I'm calling knowledge sharing, and I'll talk a little bit about why I'm calling it knowledge sharing and focusing exclusively on data sharing. The first thing is sort of this is the ideal goal. We need to meet people halfway. We can't force people to share their data, but given these partnerships involve very diverse organizations, community organizations, philanthropic organizations, religious organizations who may not normally collect data and share data. They don't think of what they do as sort of a data-centric approach, whereas opposed to the partners involved in police and public health and courts and probation. They're very much about data, at least for administrative purposes. So they know what it's about. They may not know each other's data all that well, and that's one thing that we want to move them towards, but they do know data. Some of the other organizations may not think of what they do as being very data-centric. They may not think of it being amenable to being put in a database. So we want to really be very inclusive here and involve all the stakeholders. So those who may need some coaxing may be the philanthropic organizations, the faith-based organizations, and some of the community organizations who may not be used to collecting data. At least they don't recognize that's what they do. We also want to make sure that each stakeholder's data are as comprehensive and reflective of their mission as possible. Most of my research and background work has been in policing. I've worked with, recently, before I came to COPS, with OJJDP on a system called SMART. And one of the things we were trying to do is to bring in data from the police about the full scope of their mission. So we think of police data, we think of incident data, we think of arrest data, we may think of field reports, field interviews that get conducted out there, oftentimes with youth. And it's formalized data that's collected, put in a data repository, and queryable. What we don't think about as often is the other types of things that police do, their outreach to youth. Who's involved in their cadet programs, who's involved in their PAL programs, what sort of outreach they're doing, what sort of programs they're involved in, and what sort of diversionary programs they're running. Who are the kids who are coming into those programs, and how do you capture information on those children at risk? A lot of what a lot of police departments do are preventive programs. It doesn't get as much recognition, and they probably don't collect data around it as formally. They certainly don't collect data around it as formally as they do for arrest data, incident data. And then I think we want the third sort of ideal element is we want these data practices to be conducive of real collaboration. Sharing, we don't want somebody from the health department to just give the police their data and the police to give somebody from the health department their data, because again, as I said before, you really need to know your data and understand it in context, understand the capacities and the limitations of the data. I won't bore you with stories about embarrassing episodes of police and researchers when they really didn't understand the data and presented findings. When somebody from the audience who was very familiar, a police officer, for instance, said, well, the reason why you've got that false hotspot is because you're recording data on arrests that take place at the police station. It's really not where the harm took place. It's not really the hotspot. There were some examples of that recently in public-facing mapping sites. Just to drill down a little bit more on this, and this is something I alluded to before, is that we're thinking of comprehensive knowledge and data management strategies, and here again the goal is to be inclusive. So one of the terms I recently came across in a book about reforming medical education that's related to one of the grants that COPS is doing with the Providence Police Department on trying to take some of the elements of medical education residency programs and bring those into policing. Talks about the concept of distributed intelligence. It's just not about the hard data, but it's about sharing knowledge, about missions and processes. In a little while, I'm going to give out this handout, and it was something that we alluded to in the discussions. Actually, Thomas sort of put me on the spot and wanted me to come up with a data sharing strategy. And once I figured out what he meant by that, we sort of coalesced around putting together this document, and we've been holding on to it a little bit because we want to get the finer points of privacy and security and FERPA and HIPAA issues sort of ironed out in a very clear way, because it's sort of an inherently fuzzy thing. So I'm going to hand it out to this group, recognizing that it's a working draft and that we'll be trying to put a finer point on this at a later date. But to keep it inclusive, it's not just about sharing hard data, but it's also about sharing knowledge about missions and processes. So in this document, we talk really about 3 tiers or 3 levels of data sharing. And one is the simple level of just knowing, getting outside of your own discipline, outside of your own silo, and trying to understand what it is that partners in this youth violence prevention mission are involved in. So the example given here is a simple example that comes out of one of the COPS publications, one of our problem-oriented policing series, about an officer in Manhattan North District, Midtown Manhattan, recognizing that there were some problems at a particular subway stop, near a subway stop, as kids were getting out of 2 different schools. One school had students primarily from uptown, from Harlem. The other school had students primarily from Brooklyn. And they were getting out at the same time, kind of converging at a subway stop. And there were squabbles, not any hardcore violence, but there were altercations. And his thought as a beat officer was, well, let me talk to the principal. Let's try and stagger the time these kids get out of school. And rather than letting the kids from one school out this door, let's let them out another door. And as a result of that, they'll go to another subway stop. And the problem was solved as a result of that, just simply thinking out of the box. So it's sharing knowledge, looking at it from somebody else's perspective. The next level, the next tier, is sort of sharing structured data in a very deliberate, effective, grounded, and ethical manner. An ethical manner is my shorthand way of talking about being attendant to privacy and security. I don't know if we have anybody here from Boston. I'm not going to go out on a limb and say that the time for the ACLU is done and we should ignore them now, but we need to be attentive to those issues, and it's a very thorny type of thing that we're dealing with because we're sharing data about children at risk. We're also sharing data that might be used to implicate those youth in court. So, and we're dealing with youth and health data, which there are a lot of attendant issues of privacy and security that we certainly don't want to short shrift. The next level, and I think there I got a little ahead of myself there, but when we talk about the structured data, we're often talking about data that we can aggregate, that we can we can take the personal information out, we can sort of sanitize it, and maybe look at it location-based versus look at aggregate data and find out what, looking at hotspot analysis or what blocks are particularly at risk based on data from public health or based on data from police without getting into the personally identifiable information. And then we move to data that's where we have personally identifiable information, where we may be sharing the data as a case management strategy to identify youth and families at risk. But again, we have to be careful on how we share that with our partners. So second tier of data is that structured data. And the third tier is the personally identifiable information. So what we want to do is think of it broadly as distributed intelligence. We want to share the structured data, and then once we share that data, we want to also understand that the data is unique to local circumstances. Anthony, in a few minutes, is going to ask a few questions about Project Safe Neighborhoods and pulling levers approaches, and I think that's key there. We're not just taking that program that was developed in another city, the so-called Boston Miracle, the Ceasefire Project, and implementing it in Salinas or San Jose or Chicago, but we have to adapt that to the local circumstances. And as Andrew will be talking about a little bit, we also have to be attentive to the type of data we have access to and the quality of that data. So with that, I'm going to ask a couple questions of Anthony. First of all, Anthony, what can you tell us about the focused deterrence / pulling levers approach and sort of the Project Safe Neighborhoods approach, particularly about its potential to be adapted to these cities, its portability, and its sustainability, sort of the lessons learned from your experience in doing research on in these areas?
Well, the first is exactly what you said. In the places that have adapted it to its local conditions are the locations that have the greatest success with the approach. It's really not a canned set of tactics. It's a set of principles and ideas that really need to be operationalized in a local setting, really rooted in an analysis of the problem, which I'll talk about in a minute. So it varies from city to city. It's very much focused on the small number of people who are likely to be the victims of violence now, usually shootings and homicides, or perpetrators. And this is usually the same cast of characters, usually a very small number of people. It's a little bit different from the typical prevention approach, where you'd be trying to prevent people from getting in that high-risk pool in the first place. The idea is you have a pool of people who are at great risk, who are causing harm to the city. How can we work together to leverage our resources to keep that pool both safe and to keep them from causing any great harm on each other or other people in the neighborhood? One of the key ideas is that it's very much a blended approach. You need strategic law enforcement, where you need to form partnerships beyond the police department and be creative in your enforcement efforts. And the enforcement has to be credible to the young people. You put a message out there that violence won't be tolerated, and you really need to back that up with effective enforcement actions. A lot of places have problems with delivering on the message, making sure they're able to be credible in that and giving that. But it's also about social services and opportunity provision. A lot of the people who are in this high-risk pool are very difficult to reach because they're not going to school, unfortunately. They're not going to community centers. And you really need that capacity to get them in the communities where they're at, whether they're hanging out on street corners, whether they're hanging out in parks. So I think it's important to blend the social service action and have people such as street workers. In Boston, we're lucky enough to have, Barbara can talk about some of the public health initiatives where they're trying to get out into the neighborhoods to reach these kids. We have clinical social workers who work with the police department and giving psychological services to high-risk kids. But you really need that capacity to get to this high-risk population. And it's about community-based action. You need to get people who actually mean something to these mostly young men, some young women, whether it's clergy, whether it's mothers, whether it's people in the schools, to give a message to these young people that they're valued to the community. We don't want to lose them to gun violence. We don't want to lose them to the criminal justice system, but we want them to stop picking up guns and hurting each other. In the communications aspect, this is a real important idea across the different sites that I've seen implement this approach. It's rooted in trying to be fair with the kids, saying you have a choice. You don't have to pick up the gun and behave this way. If you do, there are these consequences. If you don't, we do have these social services that we can funnel your way. Whatever it is that you might be facing, we'll try and get you involved, whether it's employment, whether it's substance abuse counseling, whatever it is that you're facing, we'll try and give that to you. So giving them a choice. There's also ideas of legitimacy. by having the community members as part of this conversation, by having social service providers as part of this conversation. There's transparency. It's not like law enforcement is dropping a bomb out of the sky on a bunch of people who, are, in a neighborhood maybe selling drugs or something like that you might see in a distressed neighborhood because there's a lack of jobs and opportunities. It's tied to a specific action, shootings or homicides that everyone agrees should not exist. So the fact that it's transparent and it also gives people choices enhances the legitimacy. And it's also focused in these conversations on really changing the norms behind their behavior, trying to ratchet it down, their willingness to respond with extreme violence if somebody's been disrespected, if someone's in the wrong place at the wrong time. So it's trying to change the norms associated with violence action as well through these communications. The evidence for this set of approaches is actually pretty good with my colleague David Weisberg and the Campbell collaboration, which some of you might be familiar with. We recently did a systematic review of quasi-experiments and randomized controlled trials in this area and found that there were 11 of them, and 10 out of 11 reported a significant reduction in whatever the targeted problem was that this approach is applied to. We do need stronger evaluations, though. We had a preponderance of weaker evaluations of the approach. In terms of sustainability, you really need to convene a line-level working group where you have people who are actually mid-level managers and empowered to act upon the data and make decisions and marshal resources who are close to the problem in order to deliver this type of intervention. But you also need an executive group where you have, say, a police commissioner, or you have a head of a community-based agency, the mayor's office, the cabinet folks, who are all in agreement and support this type of group so that people at the line level can actually get the work done. And you need to change this into a way of doing business, which I think is the biggest challenge, that it's not just inherent in a group of a small number of talented people, so when one person moves on to a better job or retires or whatever the case may be, that it outlives those people, that it's really a process. So those are some of the big insights on the different sites and Project Safe Neighborhoods and other federally supported initiatives who have taken this approach on.
Yes.
What's would be the search for the Campbell Collaborative piece?
Excuse me?
What's the search for the Campbell Collaborative?
The search how to get the access to the document?
Yeah, what would I, if I go to the Campbell Collaborative website?
It wouldn't be there yet because it's under review.
Okay.
But if you send me an email, I can send you a copy of it. The Campbell Collaboration has as you know, a very rigorous set of processes to make sure that the review has been conducted correctly, and I'm happy to send that to you if you'd like.
Perfect.
I have a question. You mentioned norm change, so I'm just curious to know what data are you monitoring to see whether this particular intervention is making a change in terms of norms, and what are those norms that you're measuring?
Well, the norms that I'm just broadly referring to is some of the street culture that dictate that young men should behave in a certain way. If somebody is disrespected, if somebody is slighted, at least in Boston, it varies from city to city, but a lot of the shootings tend to have a trajectory where somebody does something in our eyes is silly, but then it gets picked up as disrespect, and it has a great deal of meaning to the young people who exist in this social network. And then that slight begets a shooting and then a series of back and forth between two groups. What we're trying to do is ratchet down on the behavior that is associated when these mostly young men get involved in the things that young men everywhere get involved in. When you go to a high school in a suburb, you have people who want to know why is that guy looking at me, or is upset because someone's dating the wrong girl. It just doesn't reach to the level of extreme violence where someone is willing to use a gun in order to settle that. So one of the metrics, the key metric that we use is shootings. Are shootings going down? There are fewer acts of violence associated with this particular set of individuals in this area when this approach is applied. And we can talk about metrics a little bit more. But
I do think that's a great question. That kind of goes to this issue of being inclusive. I mean, we know pretty well how to measure violence and to count up incidents, but we don't necessarily know how to measure collective efficacy or changes towards more pro-social value. We think that's the mechanism, along with the focused deterrence, that's driving these reductions, and hopefully these kids buy into the message. But we don't, that's very difficult to measure because it's a pretty fuzzy concept. So we need to be thinking about the ways to measure it. Richard?
Yeah, it's difficult to measure, no question, but there may be indirect ways that we use during PSN, for example, monitoring jail tapes. It's amazing what you're going to hear on the jail tapes about people calling each other, offenders who are already in jail, spreading the word. My favorite one was actually the guy who called his mother to tell her to get rid of her guns because she had a felony conviction because the feds were doing new things and they were serious about it. Focus groups in jails, in the correction centers, and in the communities will give you feedback on those kinds of perceptions, and we did those. And then interviews with folks in those targeted communities. We also did surveys with the probationers and parolees. So, you can start building those metrics.
Yeah, we're talking about both quantitative and qualitative.
Sure.
Yeah, right. Exactly.
So we have to be conscious of, because when we do hotspot analysis, we always think about those indicators that are quantitative, but there's a whole lot of qualitative data that we have to consider.
Yeah. That's one of the biggest challenges is building those indicators and actually being able to take the time to do that sort of very nuanced work to try and look at whether there is real change.
And you may also look at what other data is being collected throughout the community. Yeah. Because I think we all tend to look at the law enforcement data.
Sure.
But I spend a lot of time working with a whole nother Center for Community Building, a disclosure here. That one happens to be run by my wife, so we also spend a lot of time talking. But they collect a wealth of other data on community building and neighborhood action that we then begin to integrate. And again, you can quantify some of the qualitative data too in different ways and be able to capture that so you can overlay it on your hotspots. One of the things we've been doing more and more, and actually the Memphis Police Department funded it, and her work was integrating more of the community data into the police databases, because they're interested, where are the foreclosures, foreclosure notifications, vacancies, problem properties. But they've also now helped her create the beginnings of a public website where the aggregated data and maps are going to be available to the community to look at. And I don't know how many police departments have actually said, it's not just us who want to use it, but we're going to shove this information out so community groups can use it, because they're the ones who have to do the work out there.
Richard makes a real great point. In Boston, the Public Health Commission has a partnership with the Harvard School of Public Health where they do these neighborhood surveys and surveys with kids in high schools. And it's a really good measure because they ask questions of fear. And you can tease out of that data whether not only by combining it with the criminal justice data, is violence going down, but are neighborhood conditions actually changing? Are people not experiencing as much fear as they used to? Are they not bringing, young people not bringing guns to school as much because they're afraid to make it to school safely? So you really do need to do a broad search for information in order to get some of these performance measures. But they're also, one of the points when we talk about problem analysis is that when you're describing your problem, you also get an idea of a lot of interesting performance measures that you can use in order to see whether the problem that you're trying to influence actually is being impacted. So if part of the problem in neighborhoods is fear, the survey data that the Harvard School of Public Health, Boston Public Health Commission are collecting is absolutely critical.
Yeah, I think it's a great point. And I think this issue about sort of what are the other data points of interest, sort of goes back to the question, and what do you think are the solutions?
Right.
Because the other measures we are looking at are things like civic engagement, participation. How do you know your neighbors? Will you call the police if you see a problem? Will you use our tip line for young people? We have an anonymous tip line. Will you use the tip line? Because it again, gives us a sense of, what are people's sort of, how are people relating to each other, and how are they relating to the institutions that theoretically are there to be helpful? And where does that fit? And do we see changes over time with any of the strategies we use? I will say, like, the places where it's harder to measure, but I'd be interested in hearing ideas are, one of the things I think every team talked about were the prevention and intervention programs and the targeting of those efforts, and knowing whether or not those efforts actually have an impact and can relate back to any of the police data that's collected around Part 1 crimes, or however you want to capture it. And I think it's much harder. Our kids in our hotspot neighborhoods attending the after-school programs. Are they connected to services in their schools? Even finding out, beforehand, which are the kids who may have IEPs that indicate that, they should be connected to a whole host of services, and can we find out if they really ever got connected to those services? And do we, where we do an intervention that's community-wide, see any changes in those patterns of connections to programs? Because I think all 6 cities have phenomenal prevention programs, but I'm never sure if the kids that we think need those services the most, or the families that we think would want to have services and benefit from them, are really getting connected. And I also honestly don't know sometimes if we connect them, does it really make a difference? And how far out do we have to look to see a difference? Because I think that's really, for the cities, it's really important for us. People talk about being results oriented, but it can't just be the homicide rate going down. It has to also be, are any of the things we do on the prevention side correlating in any way to reductions? Because that would be like the long-term strategy. So curious, like, how you guys are thinking about linking those, what often are very different, sort of data sets, if there are data sets at all.
Well, 2 thoughts, using Boston as a local example. One is, you got to be what I call a data entrepreneur, and you got to be, very opportunistic. So, one of the things that we're concerned about is whether kids who are subjected to these focused interventions, are they recidivating? Obviously, you can figure out whether they've been rearrested, but are they changing their behaviors as well? And there's lots of different employment providers in the city of Boston, but our main one, YOU,
Right.
Youth Opportunity Unlimited, they actually keep data on who's been referred to them, their upkeep, etc.
Unfortunately, we got to go talk to a surgeon general.
So, but by getting access to that database that they keep on who's coming through their doors, how long they stay in their employment programs, whether they actually get a job, we're able to look at, for our list of kids who have been subjected to these focused interventions, are they starting to change their behaviors? And one of the challenges, though, which is something I'm sure Andrew would talk about, is when you are a data entrepreneur, you open up this database, and it's often not in a format that's very usable. And I say, okay, well, I see where the data is, and I see how I can get the information I want, but I need a professional who actually can stitch these together and put it in a format that's usable, because not all these databases talk to each other, and it's very difficult to work with sometimes.
I think that's a great transition, and hopefully we'll have some time for questions at the end. Andrew, do you want to come up here, or do you want me to just drive the
Actually, just go to the next slide, and we'll just do that one and go from there. So you don't have to look up there quite yet. I'll just walk through this, and you can review some of this. But so my company's been doing work in the data sharing arena for about 10 years now, and our goal was to actually get to the point of case management level data. So how can you use data on an individual level on a regular basis and as close to real time as possible? And truthfully, it's taken us 10 years because in that process, we've had to review HIPAA, FERPA, NIST, PPRA, state privacy acts, et cetera, to get where we are. And one of the things that we did was we actually brought on a team of municipal lawyers, former municipal lawyers, to take a look at our protocols to see kind of, are we meeting all these guidelines. We then take those protocols and meet with city attorneys and municipal attorneys to go through, as well as privacy officers within departments, to make sure that these things are following. And as a matter of fact, one of the lawyers that we work with used to work for the ACLU. So we're trying to include the ACLU in our processes. But one of the things that I think is really important about, as you get down to the case management level, is to continue to, I think, reiterate the theme of keep it simple. One person said, I think in the general presentations, that it's important what question you're asking. So what is it? What is the issue that you're trying to address, and what is that? So instead of let's just amass all the data sets, let's try and focus on some of the key issues. So one of the things that we did, one case study, is we're working with mental health, human services, and juvenile probation in one county arena. And when we took a look at the cross matching across all three departments, we found that there was 1,083 that crossed all three. 51% of that 1,083, 1 in 2, committed a serious crime. And that's a violent crime, many times with a weapon. 1/3 of those commit the crime after crossing over all three departments. So what we found is actually it was a 90-day or more intervention period that you could intervene into these people's lives before they committed a crime. So this kind of information becomes crucial in terms of a process of identifying folks that you can work with to both reduce crime but also increase outcomes like health outcomes as well as educational outcomes. So we're in the process of working with various counties and cities to establish these kinds of real-time case management systems. And what we're finding is that, again, I'm going to just reiterate lessons that were all said. So one, it's not one size fits all. Who is leading the collaboration? What is the focus of the collaboration? And what is the infrastructure are factors in this process. Who your city attorneys are, who your county councils are, also play a factor. We had a city attorney in one place that said, because it doesn't say in the State Privacy Act you can share something electronically, we assume you cannot share it electronically. Even though it says you can share the data, but it didn't say specifically electronically. So their ruling was that you can hand it on a piece of paper, you can speak it by word of mouth, but you cannot share it through an electronic conduit. So stuff like that you have to build for. So what we've found is, as I said, one size does not fit all. So there's factors that you really need to think about. One is who is leading the collaboration? Is it health-led? Is it criminal justice-led? Is it, we work with courts. So we have a court diversionary program whose goal is primarily to keep people out of jails and out of prisons. Is it education-led? So is it primarily education outcomes? We have a project in which they were able to target a specific cohort, and when measured on both GPA and incidents with the police, they found a huge reduction from like 300 incidents to 20, and from a GPA of 0.65 to 2.2 within the course of 18 months. So there's stuff like that you can start doing, with this kind of work. I think the other thing that's important to think about, or things that you start to discover when you do this cross-data management, is that one, you can start to develop your own predictive indicators. And again, I don't think one size fits all. So these things that I tell you, they're guidelines, but really you have to start looking at your own data. And I really agree with Anthony that you have to really, 50% of what we do is to educate people on the data they already collect. So like, what do they have in their data, and what's wrong with their data? And, like dates are like an incredible problem in the work that we do. What is the date of an actual incident? What's the date of an actual service? Addresses are a killer. So like, is this an address of a police station? Is this an address of an incident? Is this an address? And is it a home address? Is it someplace somebody's staying, et cetera, et cetera? So keeping it as simple as possible is critical. Understanding your data is critical. But what you find is that if you use a fairly standard methodical process, you can start looking empirically at your information and finding things like this. So looking at the data, doing a chronological scan, doing some important conversations internally, you can find this kind of 1,083 target population. And what you find in a place like, in a city that's like maybe 1 million people, it means addressing 200 to 300 a year. So it's not this overwhelming number. But if you get down to this level, you can start doing that. I think secondly, if you use existing research, third-party research, it'll be an important piece. So schools are finding a lot of indicators, to what is going to be either future achievement or problem risk areas. Health is doing the same thing. So in the research arena, there's a view that at 8 years old, if you're having absence problems, it will demonstrate, underachieving by grade 3. Right? So at 8 years old, you can actually start identifying some of these things. At 10 or 11, you can start identifying critical issues that relate between absences and mental health and incidents with probation. And then at 14, 15, I think it starts to integrate into a lot of the research that Anthony's doing in terms of, like, who are some of the target populations that you need to really go after that are committing these crimes, that are, at risk for these issues. So I think as you go into your own data, you can start using empirical and research, and then the combination of the two. And what I mean by that is, for many of you, as you start to integrate multiple agencies, you will find different agencies use different intake forms. And those intake forms are actually doing assessments all along. So like in one situation, there is an agency that's using a form called the Children Adolescent Needs and Strengths tool. Now, unfortunately, that tool is like 550 questions. So what they did is they reduced it down to the core, maybe like 50 questions. And they integrated out of mental health into the juvenile probation department. So every child that comes into juvenile probation goes through this intake process. And from that, they have a 4-tier method for identifying who is at serious risk in terms of either suicide, trauma, and 2 other categories. What they've been able to do then is refer those individuals to wraparound services, because there's a collaboration going on between probation and health. So there's a lot, I think, that can be done. I think, as John was saying, it has to be very deliberate, it has to be very careful, it has to be very grounded. But I think you'll find that you will find in your own data, methods for identifying these things.
I think if there are any truisms out there in the work that we're doing, we've heard people we've heard actually spoken about very explicitly yesterday about the sort of the variations on the 80-20 rule, that a small portion of offenders are responsible for a large disproportionate amount of events, crimes, and geographically speaking, a small number of localities are responsible for a disproportionate amount of crime. David Weisberg says that crime is more concentrated geographically than it is among people. So to get a bigger bang for your buck, placing scarce resources where they are needed, you should follow both approaches, but you might get better value for your money doing things like hotspot policing. What I think we need to do, though, is turn the lens more on the preventive end of it. That 80-20 rule or some variation of it probably applies to children at risk of being victimized as well. So we need to better understand who are those persons and where are those places that are most likely to be victimized, and sort of turn our problem-solving attention to that.
So, to Andrew, do we have any data that shows, like with those numbers in that particular county, once we apply wraparound services to the individuals, what changes occur? What did the recidivism drop? Was there any results out of that work?
So 2 of the, and there's like 4 case studies in this presentation. I could send it out to folks for them to take a look at. So in one of the, as I mentioned, in one of the counties that we're working in, they saw a reduction in incidents with the cohort they were working with. It went from 300 to 20, and an improvement in grade point average for that population, which also meant an improvement in attendance, school attendance. So that was one. In another one of these examples, what they were looking at is health issues, health indicators. And so they went from, they actually cut their crisis incidents with the highest risk populations in half. So they are seeing results in terms of outcomes like that. And it's in the slides, so I can send it to you.
Gentleman in the blue shirt.
I'm Josh Ray from Chicago Public Schools. As a quick follow-up to that, two things. One, are those causal? So those results that you're seeing, do you think that they're causal or they're correlation-based? And then second is on the data sharing piece. That's obviously a huge thing for us. We would love to be able to share data with DHS and police, everything. Have you found effective strategies to kind of get through FERPA and the laws that you're talking about?
So on the first part, the research on its causality is kind of going on now. I mean, I would have to say that it's...
and I don't care, by the way. I just wanted to...
No. I think it's a fair question. I mean, it's... I'll need to call Ed to find out about whether it's causal. But I think that, because we've only been doing this maybe 2 or 3 years now, we are seeing results, but in terms of being able to longitudinally show causality, I think we have a little bit more work to do. But if they're dramatic enough that there is a view that, it's the populations. So once you get down to case management, you can actually look at that population beforehand and that population afterwards, and you have at least some corroborating information. It's not the double blind yet, but I think we have something to work off of. In terms of the security stuff, so I think as John had laid out at the beginning, it is a process of being very deliberate about it. And so we have found methods for, and the way we talk about it is it's not getting around FERPA, it's not getting around HIPAA. We look at HIPAA and FERPA as actually the guidelines to use for sharing data. So like they direct you in terms of how to use it. So HIPAA, in terms of its discussion of business associates and their use, FERPA has a similar contractor set of clauses that control third parties like myself, and then using state-based policy around what are child protective high-risk child protective records, what are violence-based records, also directs you on what you can and cannot share. And so you just need a technology platform that's flexible enough to build for that kind of thing. So we've had to morph and build based on all the protocols locally, and we've had to actually meet with the city attorneys and go through this is how it plays out. Write a protocol that they can review and say yes, that makes sense, and go.
And I think that may be the key. This isn't a vendor-based system where you're just buying something, boom. And that's what I would caution everybody about. They're out there, they will promise everything under the sun, just like you'll hear promises on police RMS systems that they will do everything and anything for you. This really does take that kind of individual matching and work. Also, being one of the lawyers, and try to keep it secret, we're trained to be conservative. I mean, lawyers' automatic response is, no, you can't do it. And you've got to work through, well, what is it I need? Why do I need it? And then sort of signals start going. I always say we forget that it says attorney and counselor at law, and it's the counselor that somehow drops off all the time. But you can work them because FERPA and HIPAA have all kinds of guidelines for being able to share information. It's just everybody automatically, I think, says falls back and no, we can't do it.
I just
think about it.
Norris Dickard, Department of Education, we are trying to issue detailed guidance to assist on FERPA. We've done it before, but we've got some guidance we had hoped, as John knows, had hoped to have it done for the summit, but it's not ready. We also, as part of our give and take with the forum localities, would like to perhaps have a webinar open that we'll send out to folks with a dialogue so that we can hear about the walls you're facing, questions you have, and perhaps we can address them. So
we're going to take 2 more questions I was getting from the hallway to wrap it up. I don't want you to be late for lunch. I'm going to hand this out. Why don't we take one in the corner here and one in the corner here.
Just a real quick question for me, and I may have missed this. Did you say you had people from HIPAA and FERPA at the table with you to kind of help you through this, or you just?
No, I had a set of municipal, ex-municipal lawyers who were going through the HIPAA and FERPA protocols with me to present. John?
Can I ask you a quick question?
Sure.
I am aware that Google provides a whole lot of crazy and free tools because they scoop up all these other companies. They have this thing called Google Refine, which does the cleaning up messy data, you know how you can make apples to apples, all that stuff. Have you worked with that at all? And is that something that we could?
No, IBM has that, Oracle has that,
So this is free?
Microsoft has that. I mean, Google's probably the only one that's putting out free. I think Microsoft may actually have some free set of tools as well. I caution on that. What that does, I think it goes back to Richard's statement. It allows people to do some of the technical pieces of it, but that has no guidance on HIPAA, FERPA, any of that
No, you'd
stuff.
have to apply intelligence to it, but
Yeah.
I was just wondering if it could be something that you could actually take advantage of the fact that this huge company is doing this. So instead of having to purpose build something in any given site.
Yeah, I mean, the one thing I would have to say is, they're probably a competitor of ours. So that's how I
I think I would also say be cautious, because too often we think it's the technology that's the issue. That's not the issue. The issue is actually making sense of the data and making sure the connections are right.
I'm going to take the facilitator's prerogative and give this young lady in the green one chance to ask a question. Those of you who have more questions, maybe you can congregate in the hallway, speak over lunch.
Mine's going to be rhetorical, then I'm going to pass off to my colleague from Detroit over here. We speak of data-driven and we speak of technology, but we do not incorporate the main culprit in these pre-existing silos that we're breaking up, and that's going to be the defalcation factor of fraud, waste, and abuse. We're dealing with a collaborative effort, so therefore we have multiple funding streams coming from the EHRs and the high techs, which we can access for funding through cooperative efforts through third-party partnerships. But as previously mentioned, the third-party partnerships, being private contractual agencies and dealing with child welfare, are excluded from external audits. Not only that, besides the FERPA and the HIPAA, we have the FOIA exemptions of 3 and 9 particularly, which exclude this data because these private contractual agencies do self-reporting, which means that at discretion, at will, they can provide information that you utilize, which manipulates and skews national data. I support this by stating that there are a multitude of federal reports from HHS, OIG. You can look at the DABs out of OIG. You can also continue into the corporate integrity agreements out of DOJ, because we have the partnership of HEAT with the Healthcare Fraud Enforcement Task Force. So my question to you is this. This is a wonderful, I'm excited about this collaboration, the new language is being used. What form of reporting mechanisms will we have for the actual real-time person involved in direct targeted case management? I shouldn't say TCM because that's Medicaid funding, I'm excluding underfunding streams. What type of data grievance bases are established for reporting mechanisms for the individuals to report, for the youth involved to report, for the violence that's going on in the residential institutions and the other juvenile facilities? The double billings of we call them double jackets, where they're billing for multiple funding streams because we don't have a data-driven administrative methodology that we can transpose from direct servicing to the individual to the administrative structure to improve the delivery and quality of services. That is a rhetorical question. Please get back with me so we can look to the legislation. I take it to
before this gentleman asks this question, if you want to send me an email, it's john.markovic, M-A-R-K-O-V-I-C, @usdoj.gov, and I'll follow up and within reason get questions to Andrew and Anthony. They're not part of the...
Man, with the question between us and lunch.
Yeah, I'm telling you, especially with that kind of precursor right there.
It's just more of a solution-based, wanted your feedback on it. There's this product we're really looking at called GIS, and ESRI that developed it, and we're looking to formulate different layers for each of our components. So we'll have a program layer that shows who's been affected. We're going to have a health layer to show, who's been serviced. And so we can compare and contrast, not only from an enforcement standpoint, but from a prevention standpoint, to see, what's going on before we send them to wraparound service. What's the psychology of it? Are these incidents happening because of such causalities as lower income statistics, what's it called again, single family home statistics, or whatever the case may be. So we're trying to use GIS, and that was the solution base I was looking for. And what's your take on something like that?
Let me give you a quick answer. One, in 4 of the 6 cities, there are NNIP partners. The Urban Institute administers an entire network of research centers and partners, the National Neighborhood Indicators Partnership. Detroit has an NNIP partner. In fact, the next NNIP meeting is in Detroit. I'm going to send Saul information about that. They have already developed all kinds of GIS products, and those partners have developed all kinds of analysis from re-entry to other things that's available to them. So I would not recreate the wheels there if you can, because the NNIP partners have integrated a ton of data. You also may be able to integrate, some of that distributed intelligence kind of issue. One of the things we're working on is integrating our NNIP materials with what's called KIM, which is a Community Issues Management System, which is actually being adapted by United Ways all over the country. It's a platform for sharing knowledge, information, and community issues discussion, and being able to grab and overlay on your local data certain types of national data sets. So your United Way may already be paying to be a KIM partner. You have an NNIP partner, so you can overlay those two things, and you're already off and running.
Gotcha. On the back of the handout for the discussion, the 2 side pages, the second to last bullet is the NNIP website. With that, thank you.